Hi, I'm attorney Casey Walker. I'm the founder of VA Disability Group. I'm also a former adjudicator, and I worked on behalf of veterans for the Department of Veteran Affairs. Because of this, I believe I'm uniquely positioned to talk about the top 10 overlooked ways to get a VA increase in your disability compensation. So that's the purpose of today's discussion. So let's dive right into it. We're going to look at some broad topics here, but before we do that, I want to get a foundation. What I mean by that is, what are the ways you can actually establish service connection? Well, there's really four primary ways you can establish service connection. You have direct service connection, and direct service connection means that there was an actual incident on active duty, and that's the most common way that you see people get service connection. Then we're going to talk about secondary service connection, and then we're going to talk about aggravation as well. So let's start with direct. A lot of people refer to direct as like a musculoskeletal injury or some type of acute injury. But we also have presumptions that fall under direct because there's something directly attributable to an event on active duty, which would be like a toxic exposure. Call it Agent Orange, Camp Lejeune, radiation, maybe you're a POW, a Gulf War exposure. So those are all events on active duty and would fall under the purview of a direct claim. Let's compare and contrast that to a secondary claim. So what would a secondary claim be? Well, maybe you take non-steroidal anti-inflammatory drugs like an ibuprofen for your migraines. And let's say your migraines are service-connected and you're taking ibuprofen every day, multiple times a day, because your migraines are largely uncontrolled. And then you start developing acid reflux. Well, ibuprofen is known to cause acid reflux. So acid reflux would be a secondary claim to the already service-connected migraines. Why? Because you're treating the migraines with ibuprofen, which cause the secondary acid reflux. So that's one example of a secondary claim. Another example of a secondary claim would be if you had a hip injury and you're already service connected with the hip injury and you alter your gait. You start walking with a limp, maybe you use a cane, and you're putting undue stress on the opposite leg and you develop a knee strain in the opposite leg of that hip. You could file a secondary claim for that opposite joint. And that would be a secondary claim. Lastly, let's talk about aggravation. Now, people often confuse aggravation. There's two different types of aggravation. One's found at 38 CFR 3.306A, and the other one's going to be found at 38 CFR 3.310B. And both of those will be found in the description, so you can look at them for yourself. But the first type of aggravation we're going to talk about is 38 CFR 3.306A. And what that is where a veteran enters active duty. So at your entrance examination, they discover that you have a condition, and let's call it flat feet. But let's say they say that it's asymptomatic and you have a clean bill of health, you're presumed to be sound, and despite you having flat feet noted upon the entrance examination, you go on active duty and you're feeling good. Well, 3 years on to active duty, you aggravate the flat foot condition that you have, and it is now worsened. You went in with a clean bill of health. Despite the noted condition, it was asymptomatic, and now it's symptomatic. So that would be one example of aggravation. Another example of aggravation would be where you have a condition that has nothing to do with the military whatsoever. Let's call it sleep apnea, for example. And you can't treat your sleep apnea because you have a service-connected condition known as PTSD that limits your ability to wear a mask while you sleep because you're hyper-aroused. Because of your inability to treat the sleep apnea, that condition would be aggravated beyond a normal degree of worsening. And this is an example found in 38 CFR 3.310B. You're aggravating a non-service connected condition beyond the normal degree of worsening because of a service-connected condition. So again, this is a foundation because we're going to dig into all the different overlooked ways to get an increase, but we have to have at least an understanding of direct service connection, secondary, and aggravation. So with all that in mind, let's jump right into it. The first thing we're going to discuss that is very overlooked is nerves. Nerves, nerves, nerves. You have upper radicular nerves, you have lower radicular nerves. If you have a neck condition, you can have a median nerve compression of the nerve because of the neck and the disc in the neck. If you have a lumbar condition that's service connected, you could have some type of sciatic impingement. This is very common with degenerative disc diseases of the cervical neck and the lumbar spine. Veterans often file a claim for the back or the neck, and they fail to file a claim for the radiculopathy or radicular impairment of those nerves. So if you file a claim for the neck or the back, be certain to file a claim for those residual nerve impairments. If you're starting to have those impairments, they typically get worse. They don't usually get better with age. Those discs start compressing more and more at age. So again, nerves, radiculopathy, lower extremity radiculopathy, which is typically the sciatic nerve, and upper extremity radiculopathy, which can be a host of different nerves. Your upper radicular group, again, that's a median nerve, the radial nerve. But the important thing is that you spell out on your claim neck with bilateral nerve impairment, or lumbar back with lower extremity bilateral nerve impairment. You have to guide the adjudicators and the examiners. They won't look at it if you don't claim it. Moving on to the second one that's overlooked, diabetes. Now diabetes, we have a whole separate video on diabetes, so you can check that out. It's in our description. But what people do when they file a claim for diabetes is they just write that, diabetes, I've got diabetes, but they fail to expressly list neuropathies, nephropathies, ocular conditions, hypertensions, ischemic heart diseases, and different heart diseases, erectile dysfunction, strokes, peripheral vascular diseases, and skin conditions. So all of those things are common with diabetes, and if you have them, you need to claim it. Don't just put diabetes. Put diabetes and put nephropathy or kidney residuals, whatever ones apply. Be certain to put it expressly on your 526EZ claim. When you file that claim with the Department of Veteran Affairs, put every single condition that you believe is attributable to diabetes. One often overlooked one with diabetes as well is depression, mental health with anxiety and depression. When someone becomes diabetic, it can really alter their lifestyle, and that has a profound impact on people's mental wellness. So be certain to also include a claim for mental health if that's applicable. Number 3. Next, we're going to talk about mental health with depression and anxiety. I always try to claim it broadly, mental health with depression and anxiety. Don't put the adjudicator or the examiner in a corner where you say, I have generalized anxiety disorder, because the examiner might say, no, we don't think you have that. We think you have major depressive disorder, or whatever the diagnosis is they think you have. So if you claim it broadly, mental health with depression and anxiety, you're leaving it open for the examiner to give you a diagnosis. Now, if you've already tried to file for PTSD and maybe you didn't have a stressor, or maybe you've never filed for mental health at all, but regardless, if you have a service-connected condition, if you have hearing loss, and you develop a little bit of anxiety because you can't hear people when you are in public settings. You avoid people now, you've altered your behavior, your social settings have changed. That can have an impact on people's mental health. So if you have a service connection for, say, hearing loss, you should be filing secondary depression, anxiety, mental health with depression and anxiety. Similarly, if you've had a knee replacement or a joint replacement, or you have profound acid reflux, whatever the condition might be, as long as you're service connected with it, don't hesitate to file for secondary mental health with depression and anxiety. Mental health can compensate well, and most debilitating conditions or symptomatic conditions can cause a little bit of depression. Another condition, number 4, that's often overlooked is when you have a joint condition and you start overcompensating. We see this a lot with hips and ankles and knees and foot problems. When someone starts limping, they alter their gait, and that causes undue stress on the opposing joint and leg. So for example, if you have a right hip condition, maybe you're leaning heavily on the left leg and you develop a left knee strain. Make sure you file for that left knee strain secondary to the right hip, which is already service connected. A lot of veterans fail to file for those claims because they say, well, I didn't have any left knee issues when I was on active duty. Again, this gets back to that initial foundation we discussed, which is secondary claims. If you're overcompensating, make sure you file for the secondary conditions on the opposing joints. Number 5, acid reflux and irritable bowel syndrome. Now, we have a different video, which is in the description, about upcoming changes or recent changes to those 2 conditions. But nonetheless, what you have with veterans is you have a lot of medication for service-connected conditions. You have painkillers, you have non-steroidal anti-inflammatory drugs, you have medicine, you have mental health medications, you have kidney medications. Well, a lot of these medications do cause stomach issues, and they do cause acid reflux. So be certain to file for any type of stomach residuals or acid reflux that you have. If you've had cancer and you're through the chemotherapy and the radiation, a lot of people develop acid reflux and stomach issues as a residual of those treatments. But the important thing is that you file it. You have to file the claim. The VA is not going to just infer a claim assuming that you have a condition. And just because you're treated at the VA medical center doesn't mean that constitutes a claim. Quite the opposite. You need to expressly submit a claim to the Veterans Benefits Administration, which is different and distinct from the Veterans Hospital Administration. Number 6. Let's talk about tinnitus and hearing loss. So if you go to 38 CFR 3.304D, again, this will be in the description, there you have a combat regulation that says if a veteran served in combat, if he develops a condition that is reasonably attributable to a combat setting, then the VA is supposed to infer service connection as long as you have a diagnosis. Well, tinnitus and hearing loss are two of the most common things that veterans have. Especially combat veterans, you're around a lot of loud noises, whether it be aircraft or munitions or weapons, helicopters, you name it. There's a lot of loud noises when you're in a combat setting. If you file for hearing loss, I suspect you probably have occasional ringing in the ears, which is referred to as tinnitus, or some people call it tinnitus. Well, file the claim for tinnitus. Don't just sit there and hope the VA will infer it. Similarly, if you get ringing in the ears and you file that claim, there's a good chance you have a little residual hearing loss. Let the VA at least examine you and tell you whether they believe you have hearing loss or not, but file for both. At a minimum, you might be eligible for hearing aids if you get service connected for tinnitus or hearing loss. Number 7. Let's talk about combat statements. Now, this isn't a specific condition. This is a principle that all veterans need to be aware of. So at the outset, we discussed the different theories of service connection, and one of them was direct. So that's the most common way that a veteran will establish service connection. They have some type of incident on active duty. There's medical records documenting it, and that's the most common way these things are documented. You get an owie, you go to the doctor, and it's documented. When you're in combat, veterans don't have the luxury of going to the doctor or the medical professional on a daily basis. It's just not available. Sometimes you're actually out in the field in a combat setting, outside of the wire, so to speak. Well, Congress finally recognized that this was an issue, and they enacted combat laws. And what the essence of these combat laws states is that a veteran's statement alone after the fact, 30 years after the military, is sufficient to establish an in-service event, despite there being no evidence supporting such. So for example, 30 years after you served in the Gulf War, you could write a statement that you lifted a very heavy box off of a military truck and you hurt your back. It wasn't documented. Why? Because you're in a combat setting and the mission had to prioritize your treatment. Or maybe you developed migraines on active duty while in combat. They weren't documented. Why? Because the mission prioritized your treatment. Or perhaps you fell in a foxhole and you injured your knee. The possibilities are endless here. But typically what the VA wants to see is some type of acute injury. They're not looking, if you develop a cancer 20 years after you get out of the military, you can't say that your cancer began on active duty because it was in combat and it just wasn't diagnosed. That's not realistic. We're looking at there's an acute injury and you have a residual today, or you developed migraines and it was shortly after active duty, you kept being treated for migraines, but you never were treated on active duty because you're in combat. So combat statements are so powerful, and it's probably the most overlooked things that even adjudicators and attorneys and judges aren't familiar with. But the law is clear. A lay statement by a veteran about a combat event that caused a current condition. Now, you still have to have a current diagnosis, but it can be attributable to a combat event. So, combat statements. Now, there's another case. There's a case that actually hashes out a little bit more details on combat regulations, and that's Reeves versus Shinseki, and that link is also provided. And I'm going to read this, but this is a quick summary of that case. It's a Federal Circuit case from 2012. This Federal Circuit Court decision expanded the combat presumption to include the consequences of combat injuries. This means that if a veteran's current condition is a result of an injury sustained in combat, even if it didn't manifest immediately, it can be presumed service-connected. So the context of this case was actually hearing loss, because the hearing loss wasn't diagnosed for 12 years after combat. But that's the essence of this case. Just because it doesn't manifest immediately doesn't mean it's not attributable to your combat lay statement. So lay statements are powerful if you served in combat. Do not underestimate combat. Moving on from there, let's talk about hypertension. You can essentially link all organs to hypertension. So hypertension in and of itself doesn't compensate well. But if you are service-connected with hypertension, or you believe that you could be service-connected with hypertension, you should claim every other systemic disease that you might have. So strokes, heart disease, nephropathy or kidney issues, liver issues, and the migraines, you name it, all your organs in some way or another can be attributable to hypertension. So just because it didn't happen on active duty, it would be a secondary claim. File for everything if you have hypertension, because in some ways probably linked in some way or another. Number 9, let's talk about cancer residuals. Veterans get so frustrated with cancer because the VA will issue a temporary 100% cancer rating. But that's regulatory and statutory. And what I mean by that is they have to bring you back in for a reevaluation. And they're going to reduce you. They're not going to keep it 100% unless it's active cancer perpetually, which usually doesn't happen. The VA will reduce your cancer. The adjudicator and judges have no wiggle room there. That's what Congress enacted, and that's the statute. So with that in mind, if you have a cancer, when you file for cancer, you should be filing for every residual thing that you might have, whether it be fatigue, stomach issues, acid reflux, depression because of the residuals, brain fog, skin issues. A lot of veterans with certain treatments of cancers from the neck up, sometimes their teeth rot out. So teeth issues, you name it, but everything that you believe is attributable to your cancer, if you have a cancer, don't leave it on the table. File it. File for everything that's attributable to that cancer. And last, let's talk about number 10 here, individual unemployability. We have a whole separate video on this, and you can watch that video for more details. But individual unemployability is the veteran's way of saying, I might not have a typical 100% evaluation, but what I do have are symptoms attributable to a service-connected condition that render me unemployable. So the criteria there is you have to have one condition rated at 40% and an overall evaluation of 70%, or you need to have one condition rated at 60%. And by virtue of your service-connected conditions, you are incapable of maintaining substantially gainful employment. Well, what's that mean? It means you can't work full-time, essentially. But keep in mind, if you file for individual unemployability, it's a claim for an increase. For example, if a veteran is already service-connected at 70% for PTSD, and they lose their job because of their PTSD, and they say, I'm going to file for individual unemployability, the VA is going to examine that veteran for their PTSD to see if there's a worsening. Sometimes that brings unwanted scrutiny to a very good evaluation, such as the mental health 70%, because keep in mind, 70%, there is no 80 or 90, it only goes to 100%. So when you file for individual unemployability, it's a claim for an increase. And if you already have a very good evaluation, it's possible, they say, not only have you not worsened, it's actually better than it used to be. So it's one thing to be aware of at least, but individual unemployability is a workaround to getting and obtaining a 100% evaluation despite the fact that you don't have the traditional scheduler 100% award. It pays identically. The only big nuance is you can't work full-time. You have to be below the poverty threshold. But other than that, it pays, the benefits are identical. And so that's an unknown way to obtain an increase. I'm going to give you a bonus one here. It's your lucky day, number 11. Temporomandibular joint dysfunction, TMD or TMJ. People say TMJ, but that just says you have a temporomandibular joint. This is where your mandible and maxilla come together at the ears, as your jawbones. Everyone has TMJ because we all have that joint. TMD is the proper term, but really what this is where you get clicking right up behind the ears here. You get clicking and pain, and you have limited range of motion of the way you open your mouth and going side to side with your lower and upper jaw. That's known as temporomandibular joint dysfunction. So how is this overlooked? Well, a lot of veterans grind their teeth at night when they have PTSD. They're given mouth guards. They develop a condition known as bruxism. So when you file the claim, if you find yourself grinding your teeth at night and you find your jaw hurting, and you develop this condition known as TMJ or TMD, you should be filing a secondary claim for it. Bruxism with TMJ, secondary to your mental health. That's the most common way a lot of veterans start grinding their teeth is subconsciously in their sleep they start grinding, or they do it throughout the day even. They don't know they're doing it. They grind their teeth. A lot of dentists will actually identify this. They can tell the wearing on your teeth that you're grinding. So you want to get that documented. If you go to see a dentist, ask them if you have it. If you do, ask them to document it. You can submit that, and then you can give a statement that you believe you're grinding your teeth and you've developed TMJ because of your mental health. If you receive a compensable evaluation for TMJ, you will be eligible for dental benefits. So even if you don't have a 100% evaluation assigned to you, which extends dental benefits in the Veterans Health Administration, even if you don't have that, If you have a compensable dental condition, which is PMJ, at 10% or greater, you will receive dental care for life. And that includes jaw guards and different treatments. So it's in your best interest to file for it. That is one very common overlooked claim that you should consider because of the dental health care that extends from it. So there you have it, 10 plus a bonus. Those are the 10 common overlooked ways to get an increase for your VA disability compensation. So let's step back. We've talked about the theories of service connection, and I've given you 10 plus a bonus actual claims you should consider filing if applicable. Let's talk about some of the unique considerations that you need to think about before you actually pull the trigger. If you already have a good evaluation, you don't want to bring unwanted scrutiny to your good evaluation. So just be cognizant of that. When you file for an increase, well, that could lead to a detrimental determination if you pull a bad examiner or your symptoms have in fact improved. File all your claims up front as early as possible. That will help you establish the earliest effective date. If you need to, file an intent to file. That will help preserve your effective date as long as you file the actual claim within 1 year. But file everything. If you think it's even potentially attributable to military duty or a service-connected condition, you should be filing it. Next, overwhelm the VA with documentation, whether it be buddy statements or letters, sworn statements that you write up, medical treatment records, medical literature, symptom logs, or maybe it's a professional medical opinion or examination report. All the above. Overwhelm the VA with as much as possible. Put yourself in a good position to actually receive a favorable decision. Keep in mind, these examiners, they don't know you. They're seeing you on a one-time basis. You got to give them something. Throw them a bone. Give them something to work with to make them think like, okay, this guy really has a condition. Don't just show up without ever trying to seek any treatment and say, I've got all these conditions. Do yourself a favor and develop the record. Lastly, when you file the claim it broadly. For example, if you develop migraines on active duty, you're going to put migraines direct and try to put like an approximate date on active duty that it happened. But in the alternative, say also Gulf War illness. Not only did it start on active duty, but it's also attributable to a Gulf War illness. That way you open the door for the presumption, potentially, and for direct theories of service connection. Similarly, if you had maybe some joint pains on your right knee on active duty, and now you have a left hip issue that's causing you to put more stress on your right knee, claim the right knee direct, meaning it started on active duty, but also claim that it's secondary to the left hip. So you're broadening the scope of theories, and the VA examiners and adjudicators need to consider those theories because you state so. You're just hedging your bet. You're giving yourself a better chance at success. Well, that's about it. We've discussed a lot here. I hope you found this helpful. If you did, like and subscribe to the channel. Have a great day. Thanks for listening.